Thank you very much. My name is Emmanuel Lado. I am the chairperson of the Pharmaceutical Society of South Sudan. I am a pharmacist by profession.
Okay. Could you tell us more about this society?
Okay, thank you very much. The Pharmaceutical Society of South Sudan was actually developed in 2006 by then under the presence of the Minister of Health, and it was developed, of course, to cater for the pharmacists themselves, the welfare of the pharmacists and the profession. We as pharmacists, our vision and mission is to improve, of course, the health system by providing education and knowledge and professional advice to improve not only the profession but also the health sector in South Sudan.
What is the challenges that facing the society? And how many members in this society?
Okay, thank you. Currently, I would say there are around 320 pharmacists around South Sudan, but an active member, I would talk about 100 and 180 active members of the society, because we have a process that need to be followed for them to become members. I would say mainly the challenges that we face as a pharmaceutical society is things to do with, of course, the education and capacity building, because to the fact that we don't have a school of pharmacy, or let me say a university, a college of pharmacy in the country as well. We are facing problems small to do with job employment, because we have also some of our positions that are taken by other professionals who are currently working in the field of the medicine.
And how many companies and factories working in the pharmacy here in South Sudan?
I would say currently there are about 50 or so pharmaceutical. I wouldn't call them manufacturers, but they are distributors. They are mainly agents who get medicine from manufacturers outside and they bring to the country and they distribute.
And what is the challenges of establishing this industry in South Sudan?
It will take a lot. It needs, the government also needs to be involved, including other stakeholders, because we know it's a huge infrastructure that needs a lot of work. It needs electricity to be available. It needs workforce. It needs a lot of things to be involved, but it's not something that is impossible if we put our mind towards it.
There is a shortage in medicine in South Sudan, and how is solved this?
Okay. Currently, I would say the medicine that is being supplied to South Sudan is mostly done by the donors, and this is mainly to cover the public sector, and then the other gaps is covered by the private sector as well. But I can still say they still need to do more in that aspect. So I believe if we put our hands together, if the government and the private sector work together, we'll be able to cover a minimum of 80% of the need of South Sudan.
Okay. As society and you celebrate this day, what is goals or ideas for the coming times?
Okay. This year, our theme is the pharmacy strengthening the health system to improve the coverage of all. My message will be that we as pharmacists, we are able to do more than what we are currently doing. So we'll be asking the government to support us in terms of infrastructure, in terms of allowing us to be able to bring in medicines, and also to allow us to reach out to the population where it's needed, to allow our pharmaceutical companies some room to import some of the medication to also help with the society.
And how do you see the health system here in general in South Sudan? What is the challenges?
But I think the challenge of the health system is still the challenge that is global, and where is access to medication, the income itself. There's a lot of things that are involved in it, but I can say it's not hard if we all put hands together and we work towards that.
Okay, as we celebrate this day, what is your message for the people?
My message for the people is very simple. My message for the people is let the pharmacists do more. I believe the pharmacists are capable of doing much more than just dispensing medicine. All around the world, the pharmacists now take the role and do the public health outreaches. The pharmacists right now are involved in governance. They're involved in finances. The pharmacists can provide enough for the economy of the country to grow. So my message to the world is, and to South Sudanese is, let the pharmacists do more.
Okay, thank you very much.
Thank you.
And that's why
Chocolate. Okay.